I cycled through like the grief that often gets talked about in a late diagnosis, but also like the anger, frustration, and then also this kind of like almost weight off of my shoulders relief that like this thought that I'd been having pretty much my entire life of like, you can't keep up with the world, like you're the problem.
Hey, I'm Dr. Janice Castro, licensed psychologist and host of Latine ADHD podcast, a space where ADHD and cultura intersect, a place to learn, feel seen, and build resilience. Whether you have ADHD, think you may have it, care for someone who does, or work in the mental health field, this podcast offers real life strategies and culturally relevant insights. What this space is not is a replacement for therapy. However, if you're enjoying it, I strongly encourage you to subscribe, leave a review, and tell me what you think because I could definitely use feedback so I can better provide you with what you're wanting to hear. So today we have Lehuanani, a licensed marriage and family therapist, a LMFT, based in California. She has lived much of her life unaware that she has ADHD, only receiving her diagnosis at age 33, 7 months into postpartum. Her personal journey toward an accurate diagnosis beyond the initial labels of anxiety and depression was long, exhausting, and eye opening. Can you imagine thinking that, oh, I got to navigate my anxiety? Oh, okay, no, I have to also navigate depression. Oh, no, now I have to navigate being pregnant. And whole time, there's ADHD at the root. Through that experience that she's had, she discovered a deep passion for supporting other women who have recently been diagnosed with ADHD or suspect that they may be living with it. Lehuanani brings empathy, lived experience, and clinical expertise to her work, helping women feel seen, understood, and empowered. I'm super excited because we're going to be able to hear her journey with getting the diagnosis of ADHD, what led to her figuring out that maybe it was ADHD or there was something going on, especially after having a baby. And then we'll also talk about how getting her diagnosis has changed her life completely. Welcome, everyone. I would like to introduce you to our guest, Lehuanani. And I'm super excited to hear about your story. And I want us to get started with our first question, which is what was it like for you finding out that you had ADHD after having your baby?
Yeah, sorry. It was a lot, to be honest. And I didn't, I think I went through so many emotions that even just now thinking about it in that like short amount of time after having given birth, I cycled through like the grief that often gets talked about in a late diagnosis, but also like the anger, frustration, and then also this kind of like almost weight off of my shoulders relief that like this thought that I'd been having pretty much my entire life of like, you can't keep up with the world, like you're the problem. All of it made so much sense after getting diagnosed. And so it just kind of, I think for months after getting diagnosed, then and like going through like trials with medication of just figuring out like what is going to work for me, it's kind of cycled through all of those things. And it's really dependent on like situation and events. And I think that's one thing that I've always kind of been told to not do is, you feel too much, you're too sensitive.
Mm.
And so having been diagnosed and learning like really in depth, especially for women, of how that shows up in our ability to regulate our emotions is just like a light bulb. So it's not just that I'm like sensitive. I may be sensitive, but there is also a reason
Mm.
for that sensitivity or, And so, yeah, in a long-winded way, there's been a lot of stuff that's been going on. And I mean, even now, as time has come between the diagnosis and where I'm at today,
Mm-hmm.
there's still moments where those emotions come flooding back because the thoughts of like, well, in high school, looking at it with a neurodivergent lens now, okay, that's why I struggled. This is why I always felt othered.
Mm.
And so I think specifically for women who are getting diagnosed later in life comes with a lot of trauma work of
Mm.
looking back at past experiences, and especially in instances where we've tended to be harder on ourselves because no one else is struggling this way. And then to have this knowledge and looking back at it like younger us, right? And
Mm.
sh- looking at it more compassionately and understanding of I wasn't broken. There wasn't something wrong with me. And so
Yeah.
I think it's been a whirlwind of emotions, and I think it kind of continues to be, but it's the diagnosis has helped with acceptance of all of the emotions that I've felt even prior to the diagnosis.
Yeah, yeah. Thank you so much for sharing the roller coaster of emotions that comes with first recognizing, like in high school, feeling othered, feeling like like there's something different, right? There, like you mentioned, feeling broken or struggling. And then when you recognize then that you get the diagnosis, there's clarity, but there's also grief. And you mentioned how it's a lot of emotions. And getting that diagnosis, I'm hearing also now, like in adulthood, has allowed you to be more accepting, more self compassionate with yourself and the experiences, especially as a woman. And you mentioned the emotions of being told like either you're too sensitive or too much, right? And like as women in general, we do get told we're too sensitive. And
Yeah.
sometimes I'm like, is it that women are too sensitive or people are not sensitive enough?
Correct. I was like, where is the emotional intelligence here?
Yeah, yeah, because so many people come to therapy wanting to like figure out and get in touch with their emotions. Often it's really hard for people to have space and get in touch with those feelings because we
Yeah.
are told not to, right? Because it either is
Yeah.
embarrassing or culturally sometimes it can be hard to express our feelings and feel validated.
Oh, definitely. I think one, as women, like you said, we're very much conditioned from a young age to be agreeable, to be quiet, to be
Mm,
seen, be like a good little princess type of
mm,
thing. And I mean, I experienced that all throughout my life. And adding in the cultural aspect of that as well. And it just gets reinforced on a different level of it's not acceptable to be angry.
mm.
You need to do something else with that, but don't bring it here, essentially.
Yeah, yeah, for sure. Women getting angry, that's
Oh.
definitely not okay. And you brought up I remember seeing on the guest form that you identify both as Latina and Pacific Islander. Could you share a little bit
Mhm.
more about how you notice culturally the messages that you've gotten that maybe made it a little bit more challenging to understand that you had ADHD? Or even maybe what are some strengths that you've noticed has helped you with it?
Yeah, so I think for my situation, I'll give a little background just so that we understand. So I grew up and my parents divorced, and it was me and my mom. And she is my Hispanic parent. And
Hmm.
so I grew up primarily in a Hispanic household culture, and I think I still do.
Hmm.
Um, the other side of that, my dad is Hawaiian, and family still in Hawaii. Very different cultures here.
Mm.
Of with my paternal side of my family, everything's very laissez-faire, very
Mm.
much like come as you are. We all have struggles. It is what it is.
Mm.
Um, and I wasn't exposed to a lot of that in childhood. And so experiencing childhood and growing up and continued in my with my mom's family, it was a lot of, even though there wasn't a lot of men in my life, very stereotypical gender roles
Mm,
of like for young girls, especially of, you know, be a good girl, be a little princess, which I have a lot of memories of like being told you're not acting like a princess right now
mm,
because I would come home and I would have sand in my shoes because I'm getting crazy in the sandbox with my friends. Princesses would be bothered by that.
mm.
I wasn't. I was more emotional and I had opinions. And in Hispanic culture, and I don't want to say it as like a blanket statement because it's not true in every Hispanic household. In my family, that wasn't something as a child that I was afforded.
Mm.
It was listen to mom, listen to family members in general, because I'm a child, which to some degree, yes, I understand. But with that also, I think the strengths that I saw in my culture, specifically growing up, were that like I can do hard things. It may take me a little bit longer for whatever reason, but the sky is the limit.
Mm.
And I don't have to limit myself because of whatever reason.
Yeah.
And so it's like, I can't say that culture was like horrible impact on me or like my family was a horrible impact on me, like with everything balanced. And so there were obviously things that we look back at now and we're like, oh yeah, that maybe wasn't great for a child. But also, my family is essentially my foundation and the reason that I have been able to persevere and get to where I am today and have my own family, have my own job, make the life that I want to live as an adult. And
Yeah.
so,
Yeah. Thank you so much. I really appreciate just hearing about your experiences with culture and just understanding that there are cultural differences. Like you mentioned with your Hawaiian side, it is more like relaxed or more laissez-faire, just come as you are, which can be very beautiful. And then I also hear that growing up, since you were more exposed to the Hispanic culture, like living with your mom, you got some messages, and I agree with you. I think when it comes to those gender roles, even if there isn't any male presence in the
yeah,
house, there
they
is
still get
still.
enforced somehow.
Mm-hmm. Mm-hmm. It does. It does. And I like when you were saying like to that you would be told like that's not what princesses do or be like a princess. It reminds me like, yeah, my grandpa used to call me his princesita. And it's just like the moment you get told these labels, it's like, oh, so I'm told I have to behave a certain way. And when I think of princesses, I think of like Disney princesses and
Yeah, and the big poofy dresses,
yeah.
like high heels, like very dainty.
Yeah, yeah, definitely. Which then can make it really difficult when you recognize that like you're not coming in like all clean and dainty after like playing in the sandbox, being a kid.
Right.
And then also I appreciate you highlighting the strength of the perseverance, the hard work, that the sky's the limit because that resonates with me too of like working hard, persevering and pursuing your dreams. And I think that that can be very beautiful. So, yeah, I appreciate you sharing just the cultural lens with your experiences. I was curious, and this is my last question is so you got your diagnosis, and I wonder how has that changed how you work, how you live, or just care for yourself?
Yeah, that's a big question. And everything has changed
Mm.
um, because it had to. Because what led me to getting the diagnosis was because nothing was working anymore.
Oh, okay.
And so it was kind of like out of one desperation of being postpartum and already knowing before getting pregnant that I had been like diagnosed with depression and anxiety,
Mm.
that postpartum depression and anxiety could be a potential thing for me. And then to actually experience it and know that it wasn't just that because everyday life was hard as far as just like, I mean, pregnancy does a lot to our bodies and it takes a lot for hormones to regulate.
Mm.
But just even the small things of like, taking care of myself, remembering to like brush my teeth, doing small things that like normally were just part of routines that I had or systems that I had already set up, right?
Mm.
All that executive function just kind of ran away and was playing like keep away
Mm.
from my brain. And I was still on maternity leave and was just like, something is not right beyond like, typical like depression and anxiety from like going through this big hormonal change. And it sounds so bad because I'm a therapist, but I think this just highlights the lack of education that like therapists can receive in schooling or in training about ADHD.
Oh, yeah.
It wasn't until like I was on TikTok holding the baby at 3 o'clock in the morning because he's crying and just like trying to kill time that like for some reason ADHD in women started popping up on my TikTok. And it hit me in the face like a wet blanket. Like I resonated so deeply with a lot of the things that I was saying. And it highlighted for me like there is a possibility that this is more than just postpartum depression, postpartum anxiety. And so now knowing that I am neurodivergent, down a rabbit hole we went and started going through all the symptoms, looking up how other women, especially in like postpartum, even if they had been diagnosed before, how their symptoms became so much more severe in
Mm.
postpartum because of the estrogen drop, the progesterone drop, and just the amount of the hormones that are essentially working against you. And then I found like stuff online about women who hadn't been diagnosed until postpartum because it threw all their systems, their routines, compensatory behaviors out the window.
Yeah.
And so with my diagnosis, everything changed because it had to, because work was no longer, I couldn't do a 9 to 5. And it made sense as to why I couldn't, why I was drained after every single day to the point where like I'm rotting on the couch, not being active, not wanting to talk to anyone, don't look at me, don't perceive me essentially. I'm not
Mm.
here. And then self-care looks a lot different now too of it's not, I guess when we think of self-care, we think of like typical things of like maybe not typical, but like, going to yoga, reading a book. And sometimes, yes, those things are effective, but for most times, my self care looks a lot different. And it's not always the outright, like, oh, yeah, I'm going to go to yoga because I need to relax and let go. Sometimes it's, I need to sit in the sun and just drink a Diet Coke and listen to a podcast or binaural beats just to bring my nervous system down.
Mm.
And so it's changed work, self care, how I show up in my life of big people pleaser prior to
Mm.
diagnosis of feeling that I should be able to, do all these social events that everyone else does on a weekly, daily basis. And because I'm exhausted after them, that's my problem. I'm the problem. And with
Mm.
the diagnosis, that mentality also shifted of, well, this is why you're so exhausted after a 9 to 5. This is why you're so exhausted when you go from a week of work, 9 to 5, and then, oh, jam-packed weekend, and then you're sick the next week,
Mm.
whether migraine, fatigue, whatever, it all made sense. And so we know ADHD is a neurodevelopmental disorder, and that literally leads into every aspect of our life. And I think that was especially true for me
Mm.
when I started to look at myself differently
Mm-hmm.
and really check in and see what I needed to work with my brain than to fit society expectations.
Yeah. Yeah. Thank you. I hear how challenging it was and like you said, the moment where the systems that you had in place just weren't working. And that's what led to this diagnosis, or like you getting tested for the diagnosis. And you're right, like all those hormones fluctuating impacts it so much more. And I can see then why it was so hard, and you were, like you said, feeling the fatigue, feeling really tired, or just having a hard time, like even wanting to be out and doing the, like what you said, the things that were typical routines of like brushing teeth or like showing up to work. It feels harder. And I really appreciate that you bring up how you saw that once you understand, like, oh, okay, this is how ADHD is affecting me, then how do you change your systems? How do you make things work for you, work for your brain, versus trying to fit into what is society's expectations? Because so much of society is like, act and behave like a neurotypical person. And that's how our jobs are set up. That's how almost everything around us is set up.
Yeah, definitely. And I think it's mind-boggling the amount that as neurodivergent people, we are expected to push aside a literal neurodevelopmental disorder to make other people comfortable with
Yeah.
productivity, with scheduling, with, all the things.
Mm-hmm.
And it's disheartening. And I think that's where so many people get stuck with ADHD or just in general of like meeting society expectations that are not built with the human in mind,
Yep.
but the bottom line. And I think that's one thing that I've specifically learned is I'm my bottom line in
Mm.
the sense that I need to take into account how all of my life things, whether work, family, social events, is going to impact my bottom line because I'm not willing to give up the
Yeah.
things that I have now. And
Yeah.
so essentially a boundary of like, this is the line.
Yes.
I'm not willing to pay that cost for us to go like all week and then 5 events because we have birthday parties, social events, someone wants to see us. Love it. No, I can't do it.
Mm-hmm. Mm-hmm. Yeah, definitely. I think that's such a great way to think about it, is you said that your bottom line, and to set boundaries around that. And, being able to choose to say no, especially when there is a lot of people pleasing that comes up, not only as a woman, but then also when people have ADHD, because they are trying to please what the majority is, which is neurotypical
Hmm.
folks.
Yeah, definitely. And it's obviously I'm still human and sometimes I'm like, I really want to say yes, or I find myself saying yes and having to like day of cancel
Mm,
and sit with like the uncomfortableness of doing that because I don't like disappointing people still.
mm,
But knowing, what this is actually filling me
mm.
because I get to be at home with the baby and my husband, and we actually get to enjoy time so that next weekend, when we've rescheduled, I'm actually fully present.
Yeah. Yeah, definitely. And making time for the self-care that fits for you too, right? Like
Correct. Hmm.
being able to sit down, drink your Diet Coke, be in the sun. And you mentioned something that I thought was really cool, and I was hoping you could expand. You mentioned either a podcast or binaural beats.
Yeah.
What is
Have you
that?
heard of that?
So I've heard of the Hertz, I think, or HHZ, like the sounds.
So I think they're kind of like synonymous. And so it's like a decibel level, right, of like the hertz. And so binaural beats, there's been significant research of it is almost like a calming effect through our auditory towards our nervous system. And it helps almost like regulate if you're, feeling too activated or overstimulated or even like understimulated, maybe even some sadness, anxiety, whatever. It kind of brings you back to neutrality in a way where it's not
Mm,
necessarily making those things go away. But for a lot of ADHDers, when our nervous system is on the fritz or where we've gone on either side of the spectrum, we can't think correctly, or not correctly, that's a bad term. We can't think effectively because
Mm,
our emotions tend to get really big,
yeah.
really loud, and that's all we're feeling. And so for me personally, when I experience those moments, okay, we need to do something for my nervous system because it's feeling like it's in fight or flight
Mm,
constantly. And I
mm,
need to bring it back down and basically establish that safety feeling. And
yeah.
so that's kind of what I use the binaural beats for of like, okay, we're gonna bring you back down.
Mm,
We'll think about those things once once the nervous system is a little bit more regulated. And like I said, it doesn't make those things go away, but it gives me a lot of clarity of, okay, I feel like I get a part of me back when I can
mm,
still acknowledge those emotions that I'm feeling
yeah.
and that trigger or the situation that caused those emotions. Because now I can look at it with clear, sound mind of like, that makes sense why I got so upset.
Mm,
How can I help myself right now? What do I need from me, essentially? So it's, again, like a self care coping skill of I get overwhelmed by big emotions. Okay, this is the thing we're going to do.
mm-hmm, mm-hmm. Well, it sounds like you're doing a beautiful job on your journey with self-care. And I'm really appreciative of you sharing your journey with that, like just the ups and downs that have come with trying to navigate the people pleasing or the disappointment or guilt that comes with like sometimes saying yes, but then choosing to say no because you're like, okay, like I'm checking in with myself in this moment. I've changed my mind and being okay with changing your mind. Yeah.
Yeah. It's something that, like I said, some days it's harder, and some days it's very easy to be like, I don't have anything to give today, and I'm
Yeah.
sorry. And
Yeah.
I mean, people that we choose to have in our life understand that we are human.
That's
But
right.
I know for me personally, the mindset is that they won't understand
Mm,
why I'm canceling or why I need to reschedule. When in reality, yeah, they get it too. And they thought about canceling too most times because they also have kids and they also work and
mm,
all of life, right? And
yeah.
so it's a lot of understanding me and my needs, but then also understanding that, like, in the greater scheme of things, we are all just trying our best.
Mm-hmm. Mm-hmm. And then our best looks different every day.
Correct. And sometimes it even fluctuates throughout the day of
Oh,
like
that's
started
right.
off strong and then we go down and we come back up.
Oh my God, yeah, for sure, for sure. Well, thank you so much. I am
Yeah.
so grateful that you've taken the time to share with us your story, your journey. And I just want to wrap it up with asking, I know I said the last question was the final, but my final question is if you have any offerings that you'd like our audience members to hear or maybe reach out to you for.
Yeah, so I don't even think I mentioned it earlier, but I'm a therapist and I do have openings for one-on-one clients. Right now, it's all virtual, but we are looking into, or I am looking into, have offering in person, as well as I do offer master levels diagnostic assessments for ADHD clients, which is the demographic that I typically work with of late diagnosed women. And it's a good stepping stool if individuals, women are feeling like something is off, but they're not sure they want to go through the whole uh, psychological option, whether going through health insurance or even wanting medication. And if it's more about self understanding and really getting an idea of who they are and why maybe things have been hard for them, which is obviously a lot of the work that I've done personally. And so it's become pretty much a passion project to help other women who are going through that beginning phase of either recently diagnosed or suspecting something.
Mm-hmm. Yeah. All right. Well, thank you so much. I
Yeah.
hope that whoever is looking for that virtual therapy, possibly in person in the future, wanting to get tested for ADHD, and working with somebody who has that personal experience of being a mother, being late diagnosed. And I'll be adding your contact information on the show notes so people can reach out.
Awesome. Sounds great.
Thank you. I am so happy we got to hear from Lehuanani talk about her experiences. What a privilege it is to be able to have her be so vulnerable with us about her struggling with depression, anxiety, being pregnant, and then getting clarity around an ADHD diagnosis while also bringing an understanding about the cultural lens, being that she is Hawaiian and Hispanic, and how there are some cultural barriers and also some cultural strengths to consider. And it was so wonderful to be able to hear about how she navigates her life now and recognizing how her getting her ADHD diagnosis was eye opening and really changed how she navigates her relationships, her self care, really all aspects of her life. And if you have not tried binaural beats, give it a shot because I thought that was a really cool tool that she shared with us that is ADHD friendly. Thank you all so much for listening and take care.